If your knee hurts right in the front below your kneecap, especially during running, jumping, Olympic weightlifting exercises, or wall balls, you might have something called jumper's knee or patellar tendonitis. Basically, both are irritation or inflammation of that tendon below the kneecap. And if you've been trying to rest it away or push through it for the last couple of weeks to months, I'm going to tell you why that hasn't been effective and what you should actually do instead. I'm Dr. Ryan, physical therapist here at Precision Fitness Physical Therapy. I work with a ton of CrossFitters and runners and helping them get back to good knee health without pain and being able to continue to work out and train through that issue. Stay tuned. We're going to go through tests that you can do to see if this is something that you're dealing with, as well as some exercises that you can do to help manage the pain, continuing to train through it and work on different mobility techniques to make sure you are not overloading that knee. So before we dive into any testing to see if you might have jumper's knee, let's talk a little bit about what it is. Jumper's knee is essentially tendonitis of the patellar tendon just below the kneecap. It's really common in people that do a lot of impact activity, so runners or CrossFitters that are doing a lot of jumping. And it essentially comes about from an imbalance in training. So too much impact, either too soon, or if there's an imbalance in some of the muscles around the knee, like you don't have enough quadricep strength on one side versus the other, or in general compared to some of the other muscles in your body, or there's a mobility issue that's causing you to overload the knee during those activities. So stay tuned and we're going to go through tests for all of those things. But a lot of people wonder, why is this still lingering after I've rested? When you rest, it allows some of that pain and inflammation to go down. But if you go right back to doing that activity, it's actually going to just come right back and you're going to still have those issues if you haven't addressed that root cause of the problem. And what happens at a cellular level is the structure and the properties of the tendon actually change when this has been going on for a long time. So rather than those tendon fibers being nice and strong and parallel to each other as they should be, they get a little bit wavy and overstretched. So it doesn't allow that tendon to stretch properly and absorb load as efficiently. And then that creates more inflammation and more pain over time. So we need to modify activity to make sure we're not continuing to press through that pain all of the time. And then we need to find out what that root cause of why you're having that issue is, address those causes, improving your mobility and your strength, and then reintroduce that activity so that we are gradually increasing it over time and allowing that tendon to rebuild itself in the process. Another way to think of this is if you're walking around with a pebble in your shoe and that was causing irritation in your foot, and you took that pebble out for a couple of days and then put it right back in and kept exercising or walking around with it on, obviously your pain is going to return. In this case, the pebble is actually the root cause of what is causing that tendonitis. So it could be weakness in your hips or in your knee itself, or a mobility issue at your hip or your knee. If you're not addressing and resolving those problems or that training load problem, then you are going to just have your pain come right back. And it would be like walking around with that pebble in your shoe again. Doesn't really make sense. So how can we test for jumper's knee or patellar tendonitis? The first and most simple thing is just go ahead and push and palpate that tendon just below the kneecap. If you have tenderness just at the point of where that kneecap is, or where it inserts down onto your tibia, where that big bony lump is in the front of the bottom of your knee here, and that is tender right along that midline, that's a good sign in and of itself. But then we're also going to do a lateral step down test. So we're going to get a box that's at least 6 inches high. If you are a higher level athlete and you do a lot of CrossFit jumping, even if you're a higher level runner with good strength, you should be doing this on a higher step, 12, 20, or even 24 inches. And we're going to just step down to the side, try to tap your heel to the ground and come back up. And we're going to see how many times you can do that over the course of 30 seconds with good, consistent form and not pushing off of that bottom leg. And then we're going to look at the quality of your movement as well. Is your knee caving in? Are you falling off of that step? Are you struggling to maintain your balance? Or are you getting pain in that same spot during this test? If you are, and there's a big difference between sides, like you're able to do many more repetitions of this on the unaffected leg, or you're able to do it without pain or better quality, that would be a positive test. And there's a higher likelihood that you are dealing with this issue. And you should go through some of these exercises to see if they're helpful. So for this lateral step down test, we're going to start on a moderate box height. If this is really painful, you can do a lower box. And you're going to put your arms out in front of you, tap the ground, come back up, and you're going to see how many of these you can do over the course of 30 seconds, trying to keep a nice even tempo, just like this. And what you're watching out for is if there's any major differences side to side. So if I go ahead and do this on this side and my knee starts caving in a little bit, or I'm having pain in the front here, or my heel is popping up off of the box. If I do this to the side and I'm coming down and that keeps happening, that might be an ankle mobility issue. If my knee is coming in, that could also be an ankle mobility or hip or knee strength issue. And we want to, over the course of 30 seconds on each side, compare number of reps that we are doing, as well as that quality of movement. So am I able to keep that knee relatively straight over my toes and over my foot? Or am I caving in and out on the sides? Or am I struggling to balance on one side versus the other? If that went well on a smaller box and you didn't have any issue with it, go ahead and go up to a higher box. So this is now 24 inches. You should be able to come down, try not to fall down, control, tap, come back up. So this is pretty much the height that I would do maximally. I'm able to fully get down in this position without my heel coming up. I can keep my knee relatively in line with my toes, tap, control, come back up. But as I go, make sure that stays consistent and does not turn into all of those things that we just talked about on the smaller box. So if you had less reps on one side versus the other, or you just didn't feel stable, you might have less quadricep or hip strength in and surrounding that knee. And that could be causing more load to go through that knee than is needed during these movements. So the number one thing that we want to work on with jumper's knee or patellar tendonitis is actually strengthening the quadriceps muscle, because those are the main muscles that go in and insert into the quadricep tendon that goes down and then inserts into the patellar tendon. And loading that properly with heavy, slow resistance exercises is one of the best things that we can do. Starting off, we're going to work on an isometric exercise that helps just reduce some of the pain and load the tendon in a way that allows it to start healing and that inflammation to come down. And then we're going to progress into higher level exercises that start working on more dynamic strength and higher loads. So first up is going to be the Spanish squat. So first up for a Spanish squat, what you want to do is on the affected side, you want to put a band right behind the crease of your knee, directly out in front of you. And we're going to get into a stagger stance to load that side a little bit more. You're going to go down into about a 45-degree bend or angle at the knee. And we're just going to hold this. So I have about 75 to 80% of my weight on this front leg. And I'm going to hold this for 45 seconds. And I'm going to do 4 rounds of this in a row. I should feel this through this quadricep muscle and down into the front of the knee. You can also then repeat this with a little bit deeper of a squat. So you want to get a little bit of lean on that band, but you don't want to be, if someone were to cut this band, you shouldn't fall backwards. So my chest is still forward, and I'm really just trying to load the front of that knee here. So as we're holding this Spanish squat for 45 seconds, we're just going to talk about why this is important. This gets an isometric contraction of that quadricep muscle and that patellar tendon, and it allows that tendon to start being loaded in a way that is going to restructure those tendon cells as they're getting loaded over time, and you continue to progress this. This also helps reduce some of the pain in that area. Again, we're holding this for 45 seconds, and we're doing 4 rounds in a row. Next, we're going to move on to single leg isolated knee extensions. We want to do this with the heaviest weight that you can do slow contractions with. So we want to do 4-second up, 4-second down contractions for higher volume of 12 to 15 reps per set, doing 3 rounds of this. If you're not able to tolerate doing that slow resistance exercise at higher loads, that's where blood flow restriction training might be a good option for you. And we'll talk about that a little bit more later in the video. Next up, we want to do some single leg knee extensions. And as I'm doing these, I'm not just swinging back and letting momentum carry me here. What I'm trying to do is stay nice and upright and stable. I'm extending that knee all the way down, and then I'm letting it slowly come down over the course of 4 seconds in either direction. And I'm really trying to feel this muscle working all the way down through that tendon, going through that full range of motion. Again, nice slow reps here. So we're going to do 12 to 15 at a weight that is challenging for this slow speed. So it might be a little less weight than you would do if you're doing regular contractions. These are a great follow-up to your Spanish squats because they're starting to work on loading that tendon through a dynamic range of motion. And we're really, again, loading that tendon in a way that's going to allow those cells to start healing and load the quadricep and starting to work on getting it stronger over time. Most importantly, while you're going through this process, you want to make sure that you are modifying your training. If you're continuing to do high level jumping exercises, jump rope, box jumps, wall balls, Olympic weightlifting, or high volume of running, you're never really going to allow that tendon to heal. So we want to make sure we're cross training. If you're a runner, you can be doing cycling, swimming, elliptical, other things that get your cardiovascular system trained and working really well, but allows that tendon to be offloaded. So reduce the running volume a little bit. You might not need to completely cut it out, but definitely reducing that volume is important. And as a CrossFitter, making sure you're taking some time to reduce the impact activities while you work on rebuilding that tendon. If we're not modifying that training load, always going to be re-irritating it along the way, especially as we're directly loading it with these exercises. So there has to be a time where that training load of that impact volume goes down, and then you're gradually reintroducing it along the way. If this all feels a little bit overwhelming to you and you're looking for more personalized advice on this, go ahead and click on the link below and apply for our personalized knee pain program. We can do a free consultation call to see if it's appropriate for you, where we coach and guide you through this to get you back on your feet. Another good training modification here is to do some slow front squats or goblet squats with heels elevated. This takes a little bit of load off of the knee, but it allows you to load that tendon in a way that might be a little bit less painful. Again, working on nice, slow contractions through as much of that range of motion as you can do without pain. You gradually want to progress from doing this with a little bit more load, making sure you are not shifting away from that painful knee. And then eventually you can take away the heel elevated position as you start going up in weight if it is not painful. Next, moving on, we're going to progress to a higher level exercise. So once that pain has come down a little bit and you're able to tolerate doing heavier load single leg exercises, we're going to do a Bulgarian split squat with your rear foot elevated. It's really important as you do that, you shift your weight over the working leg, keeping 80% of that weight on that front leg, and that you keep your foot closer in so that we're biasing that quadricep muscle and not your hamstrings and glutes. And again, doing slow reps with this to allow loading in that tendon in a way that will allow the tendon to heal and continue to build in strength. Once you're able to start squatting without your heels elevated and you're having a little bit less pain, a next good progression is to going to a single leg Bulgarian split squat. And it's important that we load more of the front of the knee and the leg with these. A lot of times people will do these with their foot too far away, which loads more of the glutes and the hamstrings. So a good trick is to fully straighten your leg and then pull back until your foot is flat on the ground, plus maybe another inch, and stand up to that spot. And that's going to be where I start my split squat. So then I'm going to grab my weights. And again, you're going to do this with a weight that you can control. I'm keeping most of my weight over this front leg, making sure that my knee is not caving in and I'm not pushing off with my rear foot. And as I'm doing this, I should not have pain as I go through. So for these Bulgarian split squats, you want to make sure you're keeping weight over that front leg, chest is coming forward, and you're keeping that heel on the ground. You should feel this all in the front of that quad and that knee as you go. In addition to doing exercises that are loading that knee and working on getting the knee, patellar tendon, and the quad stronger, we also want to strengthen your hip muscles because these muscles help control that knee. So if your knee was caving in during that lateral step down test or you were feeling unstable, these muscles might need a little bit more work. We're going to start by doing a side plank clamshell. It's a little bit higher level than a regular clamshell. There's nothing wrong with clamshells, but they're not super effective because you're not weight bearing through that leg. So by turning it into a side plank, we're going to press that bottom knee down, get yourself up and use that hip and that core to help control your knee a little bit better and start building strength this way. We're going to go up into a side plank, but you're going to think about pushing down with your bottom knee like this so that you're opening that bottom leg up into a clamshell. And then we're doing clamshells at the top. I like to hold this position as long as you feel like you can without dropping that position of your hip. So once this starts sagging down, then we'll call it a rep there. And we're going to try to do 4 rounds of this per side. So aiming for 12 to 15 clamshells in the top without dropping. What this does is it starts working on those hip stabilizers in the outside that are responsible for controlling that knee mobility. So you might be asking, what's a realistic timeline to treat jumper's knee and for it to go away? Well, first, if you're not modifying activity like we talked about, it's probably going to linger on for longer than it needs to. So first, make sure you're modifying that activity and minimizing the impacts and the jumps and that running volume so that you're not constantly overloading it. If you're doing all the right things and you're going through these exercises and continuing to progress them, make them more challenging as you go, it should be something that takes anywhere from 4 to 8 weeks to resolve, but it might not mean that it's 100% resolved at that point. You need to continue working on the strength even beyond when that pain goes away, and then incorporate some of these as maintenance afterwards. All right, quick recap. Jumper's knee is also called patellar tendonitis, which is irritation of that tendon just below the kneecap. And it's usually due to too much of a impact load on that knee, as well as potential imbalances in mobility or strength surrounding that knee. And it's really common in CrossFitters and runners because there's a lot of impact involved in both of those sports. So if you've dealt with jumper's knee before, I want you to comment below what has worked, what hasn't. If you tried any of these exercises that were helpful, let me know so that we can chat about them in the comments. If you're still struggling with jumper's knee after trying to rest or do some of this stuff on your own, you might just need a little bit more of a personalized program and help along the way. That's where I want you to go ahead and click on the link below in the description for a free discovery call to see how we can help you and guide you along this process and give you a personalized plan that is more specific to your needs rather than general exercises like in this video. If this was helpful, I want you to share it with someone in your gym or in your running group that might be dealing with the same thing so that they can have some relief and get some help with the exercises that they might need that actually helps them improve rather than just kicking the can down the road and resting.